It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, we just continue adding doctors here in the greater Hazleton area. Lehigh Valley Health Network's on a roll. We have some very exciting things happening. As you know, when John Fletcher is here, who's now the president, said many great things are happening. And today I'm proud to introduce to you, probably no stranger to orthopedic medicine, but Dr. Joseph Horton, who is joining the Alliance Medical Group, is here as a guest on my show today. And we're going to learn about Dr. Horton. Joe, how are you?
Very well. How are you, Sam?
I'm doing fine. Thanks for coming on the show. Now, tell me a little bit about yourself, Joseph.
Well, I grew up in the Philadelphia area. I went to school there, went to St. Joe's University, and then what was called MCP Hahnemann, now is called Drexel School of Medicine. Did a fellowship in sports medicine in New Mexico, and then I've been practicing orthopedics now for about the last 7 years, most recently in New Mexico.
So tell me, I'm always fascinated. Different doctors, they go into different areas of medicine. You know, first of all, when did you decide you want to become a doctor? Okay, yeah. And what made you go into orthopedic medicine?
Well, it's funny. I originally thought about being a doctor because when I was younger, my little Irish grandmother wanted me to become a priest, Ooh. And I knew I had to come up with something good. In order to get out of the priesthood. That. Well, she always said that, you know, it's a blessing for the family. And I mean, I'm talking like 9 years old. So I'm like, oh man, I got to come up with something.
Were you an altar boy?
I was.
Okay.
And,
that brings it closer.
So, yeah. So I had always been interested in medicine as well. So I thought that was pretty good. And she kind of said that one was okay. And then as I got into school, I always liked science and I liked the applications of science, and basically, that's what medicine is, the applications of science. So
how did you get into orthopedics? Why did you go become a medical doctor? Or?
Well, yeah, I went. Well, you go to medical school and you go in thinking you know what you want to do, yeah. And then invariably you will change. So I went in thinking maybe radiology or maybe like a primary care with sports medicine, tilt to it. And then I did my orthopedic rotation, which I did actually in Allegheny General in Pittsburgh. And as soon as I started it, I knew that's what I wanted to do. They had the big drills and the hammers, and I was like, this is the best. Because in my spare time, you know, I'd kind of tinker around with cars and different things like that. And to actually do it on the body, you know, practice putting in plates and screws and things like that was just very interesting. And I knew right away that's what I wanted to do.
It is fascinating because, you know, how long you've been in orthopedic medicine?
I've been out in practice for 7 years, but it's been about actually 14 years since I started in orthopedics.
Now you're married. We were talking
Correct.
about you have
Yes.
you have twins, right?
I do.
Yeah. And it's interesting. We were discussing boy and girl. So do I have a boy and girl. Wait till you have grandchildren, then it becomes even more fun.
Yeah.
More fun. Your experience, you have ties here in northeastern Pennsylvania, right?
Yeah. Well, all of my family is in Philadelphia area, New Jersey area, Delaware. Basically, everybody's on the eastern side of the state. My uncle's in Morgantown, PA, and we recently were just in New Mexico for the past 4.5 years, and it would take literally a day to travel back home. And the kids are getting older. They're going to be 5 in August, and they know they don't live near grandma or their cousins. And my wife and I just said, we got to get back to family. So we just need to get back to Pennsylvania. So that's started us looking, and then luckily we found this great opportunity here in this lovely community, and we said, let's do it.
So when you come into the area, and it's always interesting because, you know, people, when we live here, you know, people live in an area, they don't know what they have, okay?
Oh, yeah.
Until someone comes in and says, you know, you have this, you know, this.
Sure.
What's fascinating about the area? I mean, other than the great opportunity you have with Lehigh Valley.
Oh my gosh, well, I mean, where I've just been living in the desert, so one thing is water and trees and green. And
deer.
Yeah, and deer. Yeah, that's right out my front door. But just to change the seasons and the snow. My little girl's all into this Frozen movie now, and it's all about the snow and building snowmen. And, you know, we just didn't have anything down there. Here, at least, my gosh, a block away, we have this huge sledding hill that used to be a ski slope. And right down the road, we have a lake, and it just, the opportunities there for just the natural beauty of this area. It's something that we were missing, being out in the desert. You get a lot of sunshine, but not really too much else.
How about your wife? Does she like the area?
My wife is originally from Michigan.
Okay, wow.
We discussed, well, if we're going to go back up north, where are we going to go? And the interesting thing is, my wife said, well, I want to live near your family instead of hers, which, God, I hope this doesn't broadcast in Michigan. But
they get us on the website.
Yeah. Okay. No, I didn't mean that. But you know, so, and we had lived in Western PA for a short time as well, so she knew the state, and she wanted to come back here. So
I asked that question because sometimes when people come, particularly medical professions, when they come into an area, are they coming in for a job? Yes, but also you have to come in for all the other areas, the things that we have to offer, because we just not come in just for a job.
Well, it was actually the reverse. We were looking at the area and then found the job.
Okay.
So we wanted to be in this area and then found the job secondarily. So it wasn't the job first at all.
Isn't that wild?
Yeah, because we wanted to be within driving distance of family. I grew up in Philadelphia, but I didn't want to practice there. I wanted to be a little bit further out, and actually growing up in this area, I know all about the Pocono region, and just from my training, I've trained all over the state. I've been in Harrisburg, Allentown. I did my internal medicine rotation at the Lehigh Valley in Allentown, the Cedar Crest facility. So I know all about the area, and this is where we wanted to be. Close enough to family, but not so they can drop in all the time.
Well, I think you do it because you have to have all the environments, and you have to have all of the amenities to be performed. As an orthopedic surgeon, okay, and I've interviewed tons of them in the last couple of years. What are some of the things? What are some of the conditions that you treat?
Well, we basically do just about every joint in the body. Now, I don't do any spine surgery. There's a special, orthopedic, or actually sometimes neurosurgeons do spine surgery, but we'll do everything: the shoulders, the elbows, the wrist, the hand, knee, hip, ankles. We do it all. And people usually fall into one or two categories. Either it's something like an arthritis condition, like a knee or a hip that's arthritic, that we do replacement surgery on, or we treat broken bones or busted tendons or things like that. So basically, it's all about restoring function to the body, and we deal with every extremity.
Now, do you specialize in anything? I mean, I know you mentioned everything, but I mean, is there this is what I really,
Well, I'm what you would say is a general orthopedic surgeon with a special interest in sports medicine. Okay. I did a fellowship in sports medicine, but I do not restrict my practice to only doing sports medicine. So I'll do hip and knee replacements. I'll do some simple hand surgeries. I'll work all over the body, but really. The thing that I have even additional training is sports medicine, so shoulder, rotator cuff injuries, knee injuries, ACLs, meniscus tears, that kind of thing. But I don't really restrict myself. The only thing I don't do is spine surgery. Don't do a lot in the foot either. But
when you're looking at sports injuries, okay, what are the most? Because when kids are out playing or whatever, even older people, sometimes some people who are older think they can do what they did when they were 20s. What are some of the most common sports injuries that you encounter?
Sure. It really goes by age. Younger people seem to get more meniscus tears if they're playing basketball. Meniscus is it's a rubbery cushion in the knee that acts as a bumper between the top bone in the knee and the bottom bone in the knee. And if you twist your knee just right, you'll tear it. And then it just stays torn and it just hurts and you just have chronic pain in the knee. We treat that with just a little scope and we just excise it. Older folks, including myself, is about over 40 now.
Boy, you're an old guy.
Yeah, I know. I'll tell you, But we get a lot of shoulder injuries, a lot of problems with the rotator cuff tendon. This one tendon on the top of the shoulder, it doesn't have a very good blood supply, And just with any kind of overhead activity, you can actually wear a hole in it, and it doesn't repair itself. So I see a lot of folks that are still active as they get older with rotator cuff tears and things like that.
So how do you prevent? I mean, I have an answer to this because I did something yesterday. My wife and I did something with our grandchildren yesterday we maybe shouldn't have done. How do you prevent some of these injuries?
Well, the one thing is to stretch. Joints like to be loose, and we get tight very quickly. So I have extremely tight hamstrings and Achilles tendons. If you're a runner, you're going to get a tight Achilles tendon, and a tight tendon is an unhappy joint. Even people in their 20s will start to get tight hamstrings, and the tighter your hamstrings and Achilles tendons and your muscles are, the more pressure is put on your joints. So if you can only do one thing, it's to stretch, and you'll find that you have a lot less joint pain and prevent a lot of injuries.
So it's interesting. What we did yesterday is we took our grandchildren down to Aussie's down there at Leesport, and they have a big soccer thing inside. So my granddaughter and grandson played their grandmom and grandpa. Now I was able to run around, but after a while I'm thinking, am I crazy here? You know, I mean, what if I do something? Because you think, you know, you feel good, etc. But you know, my wife's, who is a registered nurse, also has a show here, The Girls. She is avid with her stretching and her exercise. She is, I mean, in the morning and nighttime, she, you know, makes sure. So she'll get me, you know, do your stretching. Now, is it best to stretch in the morning? I know we have on our news here, we have a segment where from Core Fitness where the girl will tell you to, you know, stretch against a wall or something, just to, you know, instead of sitting down for 2 or 3 hours. So what's best, in the morning or at night or both? And when you say stretch, explain what is it, calisthenic or what is it?
No, usually what you want to do is hold a static stretch. There's also things called ballistic stretching, but sometimes that can get you into trouble because it's a little too much on the joint. But basically, you just want to stretch the muscles and the tendons that surround the joint that you're stretching. And it's very important to do it before an activity. So, like you weren't playing soccer, stretch beforehand, and get yourself nice and limber and loose, because tight joints have more pressure on them, and you're more prone to injure yourself. But as a general thing, you know, if you want to stretch in the morning or at night, that's fine. Just keep it loose. And the thing you'll find is you can miss a couple days of stretching, and you'll tighten up just like that. And it's not a fair thing. You stretch for a month, you take 3 days off, you're just as tight as a month ago.
No kidding.
It's
not like a rubber band. You keep on straight, it'll stay loose.
So, but if you keep up with it, then you'll be loose. And then definitely stretch before an activity. If you're a sporting activity, absolutely.
So, how many minutes? I mean, is it?
It doesn't have to be very long. I mean, 10, 15 minutes is a really good stretch. You know, you don't have to. You don't have to do it for an hour, but
take it easy with the stretching.
Yeah, exactly. It's a slow, constant stretch. That's what you want to do. You don't want to bounce because then you could actually tear a muscle and tear a tendon with that.
And so, rule of thumb is stretch. You know, do exercise, folks. I'm talking to Dr. Joseph Horton. He is joining the Alliance Medical Group in the orthopedics area, and his phone number is 570-501-6730. We come back, we're going to learn a couple more hints about how to stay healthy and when do we really get that knee replaced. Stay with us. Hey folks, thanks for staying with us. I'm Sam Lesante. Thank you so much, folks, for making our show, the Sam Lesante Show, #1 talk show in northeastern Pennsylvania. I really appreciate that, folks. 165,000 people now watching our show on our 3 systems. Now remember, in Comcast, we're on 190 in Pottsville, Channel 13 up here, and 19 in the Mountaintop, Wilkes-Barre, and Kingston area. My guest today is Dr. Joseph Horton, orthopedic surgeon, joining the Lehigh Valley Health Network. Remember, you can watch us 24/7 on ssptv.com. My email, folks, sam@ssptv.com. All of our health shows are there. If you want to learn a lot more about what's happening in the Lehigh Valley Health Network with our local doctors, go to that particular area. We're talking about stretching, okay? And before I talk about how many people should be getting their knees done or whatever, we're talking about golfing, okay? So, you don't do that much in the wintertime, so you're excited about getting out golfing, and my son and my wife and my daughter, we get out maybe once a week if we could. And first time you get out, I figured, well, you better do the stretches, right?
Yep.
How important is that?
Oh, it's very important, especially if you haven't done anything all winter. And, golfing, any kind of sport stresses certain muscles that you don't normally use. So if you've been sitting around all winter and that first day of golf, I mean, you might as well take the ibuprofen on the 9th hole because you're going to be sore for the next week. You really got to think, kind of ease into it and do that stretching before you get that first round. It's very important.
Swimming is good for you, isn't it?
Swimming is good for you. It's a very good aerobic exercise. It's very good for weight loss. It can be a little hard on the shoulder joints depending on your anatomy, though.
All right, now, I have a couple friends of mine, okay, who constantly have pain in their knee. They take a pill or whatever, etc.
Yeah.
Pain. How do you know when it's the right time to investigate a total knee or hip replacement?
It really depends on your pain and your level of function. So if you're having pain, once a month, you get a little twinge here or there, or even maybe once a week, and it goes away pretty quick, then that's not bad. It's when you start to have pain every day. It's when you start to limit your activities, where you're like, well, I don't want to go to the mall because I'm going to have to walk too much. My knee's really going to hurt.
Yeah.
Or I'm just not going to play golf anymore because it's my knees just hurt too much.
Yeah.
That's when you need to get it checked out. Get in, see somebody, get some X-rays. It might not be that bad. You might be able to get by with some medication, or we have certain injections that we do that can keep you going. Or, sometimes people come in and the knee or the hip is shot. It's down to bone on bone. And at that point in time, then it's time to start thinking about the knee replacement. But if you come early, then you can kind of plan it out. You don't want to be in so much pain that you need to get it done right away, because maybe it's the middle of the summer and you're like, oh, I don't want to be laid up in the summer. I'd rather do it in February when the weather's bad and I'm going to be inside anyway.
Well, the surgery itself is not a difficult procedure. I mean,
yeah.
It's surgery. I mean,
sure.
But
yeah.
If you need a knee, you get it replaced.
Yeah,
It's not like just like that.
Yeah,
but I mean,
well, it is inpatient surgery, and the thing is that a lot of people that get it done, they wait to a point where the knee is hurting so much that the surgery doesn't really bother them that much. They actually feel better the day after surgery. You ask them, how's your knee feel? They say, well, it's sore, I feel the incision, but actually the knee itself feels actually better than before surgery. And that's the day after surgery. And we'll get people up and walking the day after surgery, and they're home in 2 days usually.
Yeah,
it's fast.
That's exciting. Why not, enjoy a quality of life, if you're a golfer or if
Sure.
whatever you do. And some people with their hips,
Yep.
I'm having to, but I'll be okay. It's, but the
Yeah.
point, I know a friend of mine who, was in my age when we went to school together, grew up together in Pardeesville, and, he had, his hips were really bad. He was just about to walk. So he got hip surgery here in this area, in the area here. He always supports the local doctors, and the guy's doing fabulous.
I had a lady that I saw who originally came in. She had 2 bad knees. She told me, I'm never having knee surgery, never. And I said, okay, that's fine. I said, I don't tell you when to have surgery. You tell me. And I followed her for a year. And she finally broke down because she actually broke one of her leg bones because her leg was getting so knock-kneed.
Oh.
And I showed her the X-ray, and we were both laughing. I said, you waited so long, you actually broke your leg. And she just started giggling at herself at how,
Yeah.
So I wound up, she said, fine, do the knee replacement on that one. She came back a week later, and she's like, when are you going to do the other one? After waiting a year.
Yeah, it happens all the time.
It happens all the time. And like I tell people, I say, I'm not going to force you to do anything, You tell me. When it's too bad, you tell me, and I'll be more than happy to help you out.
So
put a new one in.
What's the recovery time? If you have your knee replaced or a hip replaced.
It's not too bad. Like I said, you're only in the hospital for about 2 days. We get you up walking the day after surgery, and then you're doing some strengthening for about 4 to 6 weeks. By the end of 6 weeks, you're getting around pretty good. Maybe you got a little cane with you just for support, but people recover very quickly. And you're walking literally the day after surgery. We get you up and you're walking. So you're not in a wheelchair. There's no wheelchairs. You got to get up and move and get that knee moving. So people are pretty mobile.
I ask this to every time I interview an orthopedic surgeon. How many times have you did a knee replacement or hip replacement, and these were people that waited till the nth degree, okay, said to you, you know what, doctor, I should have done this. I should have done this right when I came in to see you. I mean, I should have really done this. It must be countless.
Yeah, it is countless. It is countless. And I just say, well, you weren't ready. I just tell them, because you need to be, kind of psychologically
ready.
You
don't say, I told you so.
Yeah, no,
What's wrong with you?
That's not a good way to go. I just say, you weren't ready. You tell me when you're ready, we'll do it. And then, I just kind of say, well, it's all good now.
Forget about the past.
It's all good now.
Sometimes when you said a typical knee recovery is what, maybe about 6 weeks?
Yeah.
In the orthopedic area, there are some treatment options that or diagnostic testing on the horizon. What's happening that you're looking at?
Well, with regards to knee replacement, it's very interesting because there's a couple different ways to go. When you have a bone-on-bone arthritis all throughout the knee, and what that means basically is all the cartilage is gone and one bone is literally touching the other bone, then you need a total knee replacement. Okay, that means that the whole thing is capped with metal and there's a plastic piece in the middle. There are a lot of people that only wear out one side of the knee, and they can get what's called a partial knee replacement, which is a much smaller thing. It's that big. And they really like their knees. If you're able to do that, because you keep all the ligaments, the ACL, PCL, all that stuff stays in there, and they really feel like it feels like a normal knee to them.
And maybe that's why they should come when they're experiencing pain. You can maybe save that.
You're correct in that, yeah. Because what'll happen is even if you're wearing out one side, eventually you're going to start to wear out the other side if you don't get the one side fixed first.
I told my buddy this. I told my friend this 2-3 years ago. I said, "You're crazy. Just go and see an orthopedic surgeon, have him check it out, And it's like you're right. If we go out sometime, if we're walking the wall, well, he's in pain, and it's come on, it's crazy to do that.
It's not a bad idea just to get an X-ray and see where you are. And even if you're not to a surgical candidate, go once a year, once every 2 years, and get an X-ray and see the progression, see how fast it's progressing. Because people ask that all the time. Well, how soon is it going to be?
Yeah.
Everybody's different. So unless you look with an X-ray, you're not really going to know. So if you follow with a couple X-rays, you can say it's progressing pretty quickly. We should do something.
So with all the advances we have today, in technology, which is fantastic, okay, and you're with a good group, it's here again. If you're experiencing any of these kind of knee pains or any hip pains or whatever, just go and get them checked out.
Sure.
Best to get it done as quickly as you can.
Just know what you're dealing with. A lot of times I'll have people that come in with hip pain and they swear they have hip arthritis, and they actually have bursitis or an inflammation of the bursa outside the hip. I can fix that with a shot in the office, and they'll be better in 2 days. And they suffered with it for years.
Isn't that wild?
Yeah.
So I would think the rule of thumb is like anything. You should go for a physical at least once a year for blood work, et cetera, see where you're at, particularly if you're a smoker, and stop smoking. Does smoking have anything to do with arthritic?
Absolutely. Smoking has been linked to osteoarthritis, low back pain. Anytime I have someone with a broken bone and they're a smoker, we're in trouble because the nicotine constricts the blood vessels. You need blood to heal. The only problem that I get in sometimes is people say, okay, I'm going to stop, and they put a nicotine patch on their arm, which is worse than the cigarette because it has just as much nicotine or more in it, and it's constricting the blood vessels.
I have not interviewed a doctor since 1994, and no matter what area, that have said smoking is bad for your health in all areas.
Yeah.
Why do we still have people out there puffing cigarettes? It drives me crazy.
Yeah, I think a lot of people, it's a habit. They don't even think about it. They just light up and start smoking because it's something to do. Now we all have our iPhones we can fiddle with, but it used to be people would just light up a cigarette when they had 5 minutes to kill. And I think a lot of that is habit.
Well, Joe, you know who I feel sorry for? I feel sorry for the elderly people who are in their late 60s or 70s, because back in the 50s, they advertised smoking. I mean, they were
absolutely.
addicted. So they got addicted a different way, and it's very difficult. I'm not condoning that. But the young people that I'm seeing today, in their 20s, in the teens, you know, in 30s, smoking cigarettes, I mean, it's just like, so stop lecturing me, okay? It's not about lecturing. It's just that they don't even know what they're doing.
Yeah. Yeah, and the problem with it is that it is very hard to quit once you've started. And if you started and you got into the habit and you're a young person, then you know, it's going to take a little bit to quit. It's not something that you just pick up and put down.
Yeah. But it does affect your joints.
Absolutely. Your joints, again, it's been linked to low back pain, bone healing, I don't even want to talk about.
No kidding.
Because that's, you might as well triple the time it'll take to heal a bone if somebody's a smoker. It just takes forever.
Well, I want to wish you the best of luck here.
Well,
okay?
I appreciate it.
Certainly
Thank
no
you very much.
stranger to orthopedic medicine, but you know, wish you the best of Dr. Joseph Horton, folks, 570-501-6730, joining the Lehigh Valley Health Network. Remember, a passion for better medicine. If you want to watch any of our health shows, just go to our website, ssptv.com. Take care of those twins, okay?
Yeah, you too.
Yeah, take care of the twins. We'll see you next time.